I think we're waiting for Bruce. Yeah, he's coming. All right, so Bruce is gathering up some more information. Welcome, everybody. Good afternoon. Thank you so much for being here for this press briefing on May 21st from the Unified Command of Maricopa County. My name is Fields Mosley. I am the Communications Director for Maricopa County, also the Lead Public Information Officer for the Unified Command. So I'd like to thank all the reporters that are joining us from our local and national media outlets here today. Also, those of you joining us by Facebook, and I think we're struggling a little bit to get to YouTube up and running, but we'll try to stream there as well. If not, we will post this later to YouTube for any of the radio stations or anybody that needs clean audio and can't get it off of Facebook or one of the other feeds. So today we want to provide you a number of updates based on what we've already told you so far. This is our 14th press conference. We've been doing this every week for a couple of months now. So we're going to have some updates on what we're doing as a county and county departments to mitigate the spread of COVID-19 within our communities. This includes programs to identify and investigate cases of COVID-19. That's being done by public health. Also, Bruce Liggett, our Director of Human Services, is here as well. He is going to update us on our support of people experiencing homelessness and the nonprofit organizations within our communities, including our shelters that support that particular group of people. I have Dr. Rebecca Sonnenschein. She is our medical director for the Department of Public Health. Also, Marcy Flanagan. She is the executive director for the Department of Public Health with us today. Robert Rowley is available as well for questions. He is the Director of Emergency Management for Maricopa County, so he is available for any questions you might have regarding personal protective equipment and our supplies of personal protective equipment and how we're distributing that. So real quickly, some logistics for everybody joining us today. Members of the media will be called upon through the webinar that we're hosting today. They're able to virtually raise their hands in that webinar and then ask questions. We have a speaker here on the table. We hear the questions, and then we'll decide which subject matter expert is best suited to respond to your questions. You need to have your mic unmuted. If you're on the webinar and you raise your hand, please unmute your mic. We appreciate that. We cannot control that from this end of it. Also, if you're having difficulty logging into the webinar or you're unable to get the virtual hand raising to work or the unmuting to work, we suggest you log back out of that software and then come back into the webinar, and we'll certainly get your questions answered as best we can. Please try to refrain from asking more than one question. A lot of times the answers are detailed. We want to make sure you get these answers in English and Spanish for those of us from the Spanish language media joining us today. Joanna Molina from Public Health is here to translate those answers during the Q&A period, so we'll do our best to help you out. Also, if you want some answers from the original presentations in Spanish, you can reach out to us here at the Joint Information Center, and we'll get with Joanna and we'll make those that information available to you in Spanish after we're done with today's press briefing. So with that, we would like to go ahead and start with the information today, and Executive Director of Maricopa County Public Health, Marcy Flanagan, will start us off.
Good afternoon. My name is Marcy Flanagan. That's M-A-R-C-Y F-L-A-N-A-G-A-N, and I am the Executive Director for Maricopa County Department of Public Health. So I'm going to give a couple of updates. The first is on the status of our testing efforts. You will be seeing early next week an RFP that is being released by the department, and that is to expand our testing capabilities in congregate settings, specifically long-term care facilities and homeless shelters. This will help us more quickly assess the situations and help start cohorting and quarantining to mitigate the spread and slow the spread in these areas. If you or a business you're familiar with are interested in applying for these RFPs, they can do so at www.maricopa.gov/COVID-19. And we are hoping to get as many contracts in place as possible so that we can have these ready to go and send the contracts out and test in whatever facilities need testing in them. The second update I'm going to give is on the progress of hiring and training of our investigators and contact tracing. We're well on our way to our goal of bringing on 79 new staff members. 52 individuals have accepted positions and 32 of them have already started. So these consist of investigators, support staff for our investigators, of data entry and analysis, and then other tasks that we need. This leaves us with 27 positions that we are still currently at some point of the recruiting process, interviewing or making offers to. And once all these staff members are on board, it will give us the capability to investigate 400 to 500 cases per day. And as I mentioned at the last conference, we have the ability to scale up this operation and continue to bring on more staff. But at this point in time, the investigation of 400 to 500 cases a day is ample for our needs at this point. And I'm going to turn it over to Dr. Rebecca Sonnenschein to talk a little bit more through the details of investigation and contact tracing.
Thank you, Marcy. So last week, I explained our process for investigations and contact tracing. As a reminder, case investigation is the process of conducting a thorough interview of each person who tests positive for COVID-19 to identify their infectious period and everyone that they came into contact with during their infectious period, and what they need to know to do now to prevent any more infections or exposures. Contact tracing is the process of reaching out to those people who were exposed to the case and providing them with instructions on what symptoms to watch for, how to protect those around them, what to do if they develop symptoms, and how and where to get testing if they do develop symptoms. Investigations take extensive training and a specific skill set before staff is ready to work independently. These new staff that we've hired will shadow existing investigation staff until they can work without assistance in about 3 to 4 weeks. We plan to begin using a text-based system to reach out to positive cases once we learn of their positive test results so that we can reach out to cases as quickly as possible. Here's how the process is going to work. As we are notified of the positive test result, these individuals are going to receive a text message from Public Health providing them with a link to a form where they can submit very basic information like what symptoms they are experiencing, and so they can receive information on how to prevent the spread of their illness to other people. They're also given a phone number so they can speak with a medical professional to ask any specific questions that they have. The text is going to include a web page with more information on how to verify that the text message is true and actually from Public Health, and some additional information on how to take care of cases and their families. The information that people provide to Public Health through this survey is encrypted, and that means it's highly secure, and it will also help the investigator get through the investigation more quickly, which will maximize efficiency for all of Public Health and for the person getting interviewed. So within a few days of getting this text message, the person who tests positive will then receive a phone call from a public health investigator who has access to the information that was submitted securely, and they will conduct a thorough interview of that individual and answer any additional questions that the person has. So the process of the text followed by a phone call will get people important information right away so that they can begin to protect themselves and their family from the spread of the disease, and also allows Public Health and our investigators to work as efficiently as possible. We understand that some people may be concerned about whether a text that they receive is real or not. So we've put a lot of mechanisms in place to make sure that you know that we are protecting your information, and ways to help people verify that the text that they receive is real and trustworthy. So first, the text will include a phone number to a hotline where they can talk to a medical professional about their situation. The hotline number is also included on our webpage for people with COVID-19, so that you can go to our maricopa.gov webpage, look at the hotline, and you can see that is a legitimate hotline performed by Public Health in partnership with Banner Poison Control. That webpage is also included in the text, and it is short enough so that people can actually type it in themselves to verify that the link is real and safe instead of just clicking on it. The webpage also has indicators to let people know that the link to the form is a real encrypted link that will keep the information they submit secure. And you just have to look for a little padlock at the top of the page, and that lets you know that the information that you're putting in is going to be secure. All combined, we hope that these education and security measures will help people feel safe, providing information to public health that will help both support our investigators to work as efficiently as possible and keep our community safe. Now I'd like to introduce Bruce Liggett, who is the Director of Human Services. Thank you, Bruce.
Thank you, Dr. Sunshine. Good afternoon. It's been a couple of weeks since I provided an update, so I wanted to share some of the status of our initiatives related to protecting and helping people who are homeless with the COVID crisis. Since we last spoke, we've added some additional capacity. So you're aware that the county has had an initiative to create alternative care sites for people who are both symptomatic or need to be isolated, and another group of vulnerable people, seniors, people with compromising health conditions. So those are the two types of sites we've developed. We now have 4 county sites in total. We have a leased facility in the East Valley for vulnerable individuals, a hotel that is being rented in the East Valley also for people who are vulnerable, and a new hotel that was added since we last spoke. It was added May 12th in downtown Phoenix, also for vulnerable individuals, 36 people. And after about a week, that hotel was filled. So in total, we have the capacity for 137 rooms that were not in existence prior to the COVID crisis. Almost 100 individuals are now in those rooms. We have some capacity still, which is important to add more vulnerable people, and also people who may be symptomatic or need some medical treatment. So we're prepared for somewhat of an increase if that occurs. We know that the county is not alone in providing these alternatives. Cities, nonprofit providers are also making arrangements for people in their care or agencies they fund. An update on the tent relocation. So 3 county parking lots were identified, were mapped out with the proper spacing distance according to the CDC. Individuals voluntarily moved into these with their tents. Some did not have tents and were provided tents. Most were provided cots. The county provided water, toilets, hand washing stations, security, and staff. But what I want to talk about this afternoon is the fact that the staff are there to engage people. So these are no longer just people living on the street. They're people in county lots. We have their names, we know their histories, and we're talking with them regularly. Human service campus staff are engaging people to see what is the next step, what needs to be done to help them move on to their path towards a permanent housing solution. So some of the people that were in the parking lots and the tents, what we call safe outdoor space, also have been identified and been placed into shelter or got medical care that were identified by staff working in the tent area. Just yesterday I was there and circled the city, an amazing healthcare for the homeless provider, had their mobile van in the lots. There they were doing all kinds of checking in terms of people's medical conditions. They were taking temperatures, they were doing wound treatment, they were doing blood pressure, and of course addressing the symptoms of COVID with people. So we hope that there's going to be able to be progress overall as a result of this. We know that some of the homeless shelters have had to reduce the capacity, the number of people they can take in, because to allow for social distancing that's required to keep people safe. So there's less capacity now in homeless shelters throughout the valley. And we've also moved some people out into these alternate care facilities I was mentioning. So we want to use our available resources now to make housing placements for people we put in these other facilities. We also know that after the crisis is over, shelters are going to be able to fill back up. So many of the people who are on the street should be able to move into shelter facilities. So what we want to do is respond what's necessary to the crisis, but use the assets and resources we've developed and the connections we're making with the homeless people to be able to help with permanent solutions for them. We know it's been a traumatic experience for everybody working with people who are homeless out in the street or in shelters. It's been hard, it's been frightening. We know that when people move to these alternate care facilities, they may have just gotten into a shelter and their lives have been disrupted. But we're trying to make that human connection with people and take this opportunity to move on to lasting solutions for people.
Thank you so much, Bruce, and thank you to Dr. Sonnenschein and Marcy Flanagan as well. At this point, we will take questions from members of the media who dialed into the webinar today. Chad, do we have anybody on the line?
We do. Peter Seymour has a question. Peter, your microphone is unmuted.
Thank you. Good afternoon, everybody. My question, I guess, would be for Dr. Sonnenschein or even Director Flanagan. Who gets the text messages about infections? Is it the people who are infected? Is it their contacts or both? And as a sidebar, would you urge people who are infected to reach out to their contacts first before they hear from the county?
Those are some good questions. Thank you very much, Peter. Dr. Sonnenschein will address those.
Yeah, I think that's a really important point to clarify. Individuals who test positive are the ones who will receive a text message, hopefully within a day of when we receive that positive result. Their contacts will only be identified once they have spoken with an investigator, and that investigator determines all the people who have been exposed. At that point, we're partnering with AZ211, who will reach out to those contacts and give them all of the information that they need to protect themselves, what symptoms to watch for, and where and how to get tested if they need it. So to answer the question about telling your contacts, if you know that you have tested positive for COVID-19 and you were just recently spending time with some people, it's a reasonable thing to say, hey, I just tested positive. I haven't spoken with public health yet. They may be reaching out to you, and refer them to the maricopa.gov webpage, because on that webpage is all the information that you will need and that they will need to protect themselves and their families. So it's okay to reach out to them, but we will also be doing that on behalf of public health.
La pregunta fue, ¿quién va a obtener estos mensajes de texto? ¿Quién los va a recibir? ¿Todo el público o nada más las personas que dieron positivo? Y la realidad es que las personas que han dado positivo son los que van a ser contactados por el Departamento de Salud Pública del Condado Maricopa y van a recibir este texto con la información adecuada para que ellos visiten nuestra página y tengan la información de un resultado positivo, qué es lo que deben de hacer. La otra pregunta es, si ellos son los mismos que tienen que contactar a las personas con las que estuvieron cercanos durante el periodo que estaban contagiosos. La realidad es que Salud Pública va a contactar a cada una de estas personas. Una vez que se hace la investigación con la persona infectada, ellos nos dirán, estuvimos en tal parte, convivimos con tal persona. Salud Pública va a contactar a todas esas personas una vez que tengamos esa información. Y también si la persona que ha estado infectada decide hablar con esos contactos y decirle, acabo de dar positivo en la prueba de COVID-19, a lo mejor tú deberías estar atento a los síntomas, pero también van a recibir la llamada de Salud Pública del Condado Maricopa.
Thank you, Peter, so much for the question, the opportunity to clarify how this new process is going to work. Chad, do we have another reporter on the line?
We do. Ann Ryman has a question, and your microphone is unmuted.
Hi, I had a question about the universal testing of nursing homes. I'm wondering if you could give us an update on that. How far along are we in Maricopa County? And also, what are the plans, if any, for the assisted living facilities?
All right, so universal testing, or I've heard it referred to as mass testing in long-term care facilities or nursing homes. The nursing home program, as most people know, is being run by the state at this point, but we do have a component of this as well. Dr. Sonnenschein can fill you in on the details.
So there's really two components of what's happening in skilled nursing facilities. Right now, the Arizona Department of Health Services is working with a contractor to test both the staff and the residents of Medicare licensed skilled nursing facilities in Maricopa County and throughout the state. So that is occurring presently, but the additional efforts that are occurring by Maricopa County are what Director Flanagan mentioned, is with this request for proposal that is going out, we are going to work with contractors to reach out to not just nursing homes, but also assisted living facilities, other long-term care facilities, and even some group homes that would like to get testing, and particularly those that are at high risk. And we're going to begin with those who, if we know there was an exposure at the facility, to test all the residents to make sure that they can identify which residents are positive so that they can cohort them together and get them in isolation to protect those other residents who are not infected. So that will hopefully be moving forward in the next week.
La pregunta fue que demos una actualización acerca de las pruebas en las instalaciones de cuidado médico de largo plazo, ¿cuándo iniciarán? Y bueno, la realidad es que Salud Pública del Condado de Maricopa hizo un programa piloto y está trabajando ahora con el Departamento de Salud del Estado, que también ellos ya están haciendo algunas pruebas que tienen la licencia de Medicare, que son las principales que deben de hacer estas pruebas. Una vez que se haga esas pruebas, Salud Pública también está contratando a otros lugares que puedan hacer estas pruebas para hacerlos en otros sitios de cuidado médico de largo plazo, que incluye hospicios y también las viviendas en grupo para personas de alto riesgo. Una vez que trabajemos junto con ellos, poder aislar a los que han sido detectados con COVID-19 de las personas que están sanas.
Thank you, Ann, for the question. Do we have another reporter on the line, Chad?
We do. Kathy Ritchie has a question. Kathy, your microphone is live now.
Thank you. Good afternoon. Can you hear me?
We can hear you, Kathy.
Great, thanks, Fields. I have a couple of questions. I wanted to, going off Ann's question regarding the testing, I wanted to see if you had any information if staff, when you begin the testing, would be tested weekly, if that will be an ongoing, or is it just a one-time deal? And then I also had a question about those encampments in the parking lot that are locked, but I can get to that shortly.
Yeah, why don't we come back around to the Safe Spaces program that Bruce has been a part of, the planning of that, or his department has. So Marcy will take your question, though, about the frequency of testing in long-term care facilities.
Thank you.
Yes, our initial plans will be to go into facilities again based on their risk, and it will be one-time testing that we go in and do. If another need arises, or as needed, if we need to go back, we will, but we're not going to automatically have a weekly scheduled testing happen in a facility.
Y la pregunta fue que si estas pruebas que serán en las instalaciones de cuidado médico de largo plazo será una vez solamente o será semanalmente. La respuesta es que al principio serán solamente una vez lo haremos. De ahí mediremos si se necesitan hacer, pero al momento solamente es para hacerse una prueba.
Thank you so much for the question, Kathy. Chad, do we have somebody else on the line, or should we get to Kathy's other question about the tent space near the Human Services campus?
Yeah, we'll go ahead and take Leon Gonzalez first, and then we'll come back around to Kathy. Leon, your microphone is live.
Hi, thank you for your time. And I would like to have the information in Spanish about the steps that the person who received a text message after being infected with COVID should double check in order to know that it's real and not a scam. Thank you.
Okay, Leon, Joanna's going to prepare for that with some of the information that Dr. Sonnenschein gave earlier. We'll provide that right after this news conference is done today. So thank you for your patience on that one. We'll get that to you. Chad, is Kathy back on the line?
Actually, we're going to go ahead and take a follow-up from Peter and then Kathy. Okay. Peter, your microphone's live.
Okay, thank you again. Next question regarding contractors. How many will you be hiring? What equipment will they need to have in hand, and who gives them the tests?
Okay, so you're talking about any vendors that choose to respond to the request for proposal, which is what we call an RFP here in Maricopa County. How will they get the testing supplies, and then who will be administering it? What kind of equipment might they need? Dr. Sonnenschein can address that.
So the way that the request for proposal is written is designed for as many people who have the ability to test and who have the staff and the capacity to apply for the RFP. We know that there's a lot of need for testing out there. There's a lot of facilities we would like to provide testing in. There are individuals experiencing homelessness, and we would also like to be able to provide testing in the community. So because of that, there's a lot of need. As many contractors or vendors who can apply as possible would be wonderful. We are asking that vendors come with their own staff who are licensed to be able to provide testing, that they have these specimen collection kits that come with them, and an existing relationship with a lab that will automatically electronically report positive results to the Arizona Department of Health Services. Additionally, they need to be able to have the personal protective equipment so that when they're testing people, they're not exposing them to disease at all. So that's a lot to ask. We're hoping that they'll bring all of that with them, but it's possible that we may be able to work with them on an individual basis if some of those things aren't, if they're not able to bring them with them.
La pregunta es, de las agencias que se piensan contratar para hacer las pruebas de COVID-19, ¿quién va a proveerles el equipo? ¿Quién les va a dar las pruebas? ¿Cuándo tienen que representarlas? ¿Cuándo las tienen que entregar? Bueno, el contrato especifica claramente que esas agencias tienen que tener su propia habilidad de hacer estas pruebas, tener el equipo de protección personal, poder tomar las muestras, enviarlas a un laboratorio, recibir resultados de un laboratorio y sobre todo tener la licencia adecuada para poder hacer estas pruebas. Si alguna agencia no tuviera alguno de estos requisitos, a lo mejor pudiéramos trabajar con ellos de uno a uno, pero eso es lo que se espera al momento para contratar a estas agencias.
All right, Peter, thanks for the great follow-up question there. Chad, is there somebody else on the line?
Yeah, we'll go ahead and take Kathy's follow-up now. Kathy, your microphone is live.
Thank you so much. My follow-up question regarding the Safe Spaces program. I'm curious what steps will be taken since we're going to start seeing some triple digits next week to keep those individuals safe, and also sanitation of those communal areas like the bathroom area, the hand washing area. How frequently is that being sort of cleaned and ensuring that folks don't spread the virus that way?
Sure. So heat concerns around the safe outdoor spaces, as well as just the logistics of keeping the area clean. It's always a challenge with so many people congregated in one space. Bruce can come up and answer that question.
Thanks for the question. We're obviously very aware of the heat, and we had a really hot week a few weeks back, but had some respite recently. So we're in discussions now, as are some of the other funders, not just the county, with the Human Service Campus, about the possibility of adding some shade structures throughout the campus for people during the day to be able to escape the heat, and what other facilities might be. Maybe there's some temporary facilities that could be used. So we're in active discussions now with the campus on that to try to address the heat. The second question related to how often we lease these hand washing stations and the water station from a professional company that does this. They're cleaned regularly. The toilet facilities are cleaned regularly, so they know the protocols that are expected of them. I believe it's daily for the toilets, but I'm not sure. But I know we have regular cleaning schedules because we shared with the vendor what the purpose was. It was to address the COVID crisis.
Bueno, dos preguntas. La primera, ¿cuáles son las medidas de seguridad ahora que se avecina el calor para proteger a la comunidad que no tiene un hogar? Bueno, hay varias cosas que se están haciendo, se está trabajando quizás en crear sombras en los espacios que ya se tienen ahorita para que la gente que no tiene un hogar esté ahí, y también buscar lugares temporales que puedan ayudar cuando son las horas más calientes del día. La segunda pregunta es, ¿cómo se limpian las instalaciones donde están las personas que no tienen un hogar, que se están quedando? Las personas que nos están quedando en un lugar, todos los días ellos reciben la compañía profesional que viene a limpiar las instalaciones, específicamente hablando de los baños. Eso fue lo que se hizo en el contrato y es lo que sucede cada día.
Thank you for the question, Kathy. Do we have another question, Chad?
We do. Tom Scanlon has a question. Tom, your microphone is live.
Yes, thank you. I have a general question on your daily report, specifically the last 3 lines, hospitalized, ICU, and deaths. Is it accurate, looking at today's, it says cases as of yesterday, 973, and then parentheses, plus 23, total cases today, hospitalized, 996. So just wanted to clarify, is it accurate to say 23 people entered the hospital yesterday due to COVID-19, and also for ICU and deaths?
I believe the answer is that, and Rebecca will take, or Dr. Sonnenschein will take that question, but I believe the answer is that it's no, there is some delay in the reporting as to what is reality. But we're getting, we pick a point in time where we release that data. So, Dr. Sonnenschein.
As Fields mentioned, there's always a lag in getting information about an individual and getting it into the information on the web page. It tends to be anywhere between 6 and 8 days for cases and hospitalizations, and it can actually be several weeks for deaths. So when we receive a case positive test result, we will call that individual, and if they were hospitalized at some point during the illness, that is when they would be recorded as a hospitalized case. So we may actually be speaking with them when they were only in the hospital for a day and already home. So by the time that lag period goes by, that individual may be home and already recovering. So there's definitely probably a good week delay before you're going to see the information on the webpage.
La pregunta es que si el reporte que ponemos a diario en el Departamento de Salud Pública del Condado de Maricopa con referencia a los números de hospitalizados, de cuidados intensivos y de las muertes o defunciones, se puede decir que son números que están actualizados en este día, son los que han surgido. La respuesta es no. El momento que nos llega el reporte a nosotros puede tardar entre 6 a 8 días para entregar esa información de los hospitales y colocarla a nosotros en nuestra página de internet. Lo mismo es que pueden pasar varias semanas para que nosotros podamos anotar el número de defunciones en nuestra página, porque eso no se reporta inmediatamente a nosotros a Salud Pública. También se habla de que cuando hablamos con una persona que ha estado hospitalizada, se habla con ellos y probablemente ya estén en casa recuperados, simplemente que apenas vamos a contabilizar esos números porque nos acaba de llegar esa información.
Tom, thank you so much for the question. And thank you, Dr. Sonnenschein, for the more detailed response there than what I have. But Chad, do we have anybody else with a question?
Anne has a follow-up question, and your microphone is live.
Hi, given the large numbers of infections and deaths that are still occurring at the long-term care facilities, have you changed any guidance that you're giving recently to these facilities? And I'm wondering also if there's other initiatives you are starting or are planning to start besides the testing.
Okay, thank you for that question, Anne. Dr. Sonnenschein will address that.
The fact that individuals in long-term care facilities are both the most vulnerable and experiencing the most serious consequences of the COVID pandemic are what has led us to the point where we're putting out this request for proposal for as many people to come in as possible, not just to provide testing in those facilities, but also to provide education regarding infection control and to actually review with the staff at the skilled nursing facilities what they're doing to keep patients in isolation, to make sure that they have enough personal protective equipment, and also that they're using it appropriately. So when you take it off and put it back on, there are lots of possibilities for contamination. So all of these pieces are part of what we're asking those contractors to do in addition to testing. And all of that is on top of having an individual liaison in public health for each facility that's experiencing cases to help walk them through the process of keeping their residents safe.
La pregunta es que con el gran número de casos que se han visto en las casas o en las instalaciones que brindan cuidado de largo plazo, ¿si ha habido algún cambio en las guías que Salud Pública les está brindando a esas instalaciones? Y al momento es que sabemos que estos grupos de personas son los más vulnerables porque pueden tener condiciones crónicas y son adultos. Entonces, por eso estamos haciendo el llamado que agencias que quieran solicitar y poder trabajar con salud pública haciendo estas pruebas en estas instalaciones y que cuenten con todo el equipo necesario puedan hacerlo inmediatamente con nosotros. También vamos a contratar las más agencias, más personal y educarlos desde cómo usar el equipo de protección personal en esas instalaciones y educar a cada uno de los miembros de esos lugares para evitar el contagio o la propagación del COVID-19.
And thank you for the follow-up question. Chad, do we have another question?
That was the final question.
Okay. If you have no other questions today, I appreciate everybody's time. Thank you to the public for being with us on Facebook today. Also, thank you to all the reporters and news stations out there for covering these press events. We try to get you as much information as we can, at least on a weekly basis, if not twice a week, and we'll continue to do that for as long as this lasts. So we will let you know about the next availability, perhaps next week. So we'll talk soon. Thank you very much.